Interventions, we're looking at the interventions. Did the nurse document that he or she did what they were ordered to do by the physician, or that they noticed needed to be done because of the assessment? Situational awareness. That's a term that reminds me of the case with the gentleman with the knees, because why wasn't everybody paying attention to his skin? If there was an order for skincare, why wasn't everybody doing it? Was it because the situation didn't seem like it called for it? Was it because when I gave report to the other nurse, I said, oh yeah, that's right, he's got a skin thing. Oh, I forgot to do it. If you get time, do it today. No, the orders are what the orders are, and when you pass the bar, that's what they're going to ask you. What was ordered? Wasn't it ordered 3 times a shift, 3 times a day? Doesn't that mean you should have done it on your shift, right? It is what it is. There's no gray when it comes to those orders and fulfilling those orders. It's within the standard of care to do what the physician says, unless you can find reason to believe that the order was incorrectly written. Were they carried out? Did we document that we did it and these are the results of it? Or are we omitting things because we're leaning on this charting by exception? And I think if you didn't document it, you didn't do it is over here, charting by exception is over here. You know, there are 2 extreme ways of documenting. And even that phrase, charting by exception, the attorney will say to you, and there's deposition testimony in here on that. What's charting by exception? Well, can we all agree to what charting by exception is? Is there one definition of charting by exception? No, there isn't. So if there's not one definition, you should never chart by exception. You shouldn't even think about charting by exception. You should think about charting based on your assessments, the treatments, the interventions, the orders, your reassessments, whatever it is that you find, you chart on. Whatever it is that you see as the patient is making the encounter with you, that's what you document on. Because all of your signatures, all of your handwriting is based on the registered professional nurse's judgment, education, skill, knowledge, experience. That's it. You're in the spotlight. We are looking at patients' education. Part of the Nurse Practice Act is that we are supposed to be educating patients on everything that we possibly could based on their healthcare literacy level. And this brings me into the conversation of we're documenting because we are protecting ourselves against defense, being a defendant, but we're also morphing the responsibility onto the patients as well. So cognitive outcomes, we're saying to the patient, listen, do you understand that I'm telling you that as a diabetic you need to check in between your toes, regularly, right? Yes. Can they really understand it? Psychomotor skills, do they have the physical capacity to, take off their shoes and socks and look in between their toes? I'm just using that as an example, obviously, to see, that they don't have any cracks or, accumulation of anything that could cause them a problem. And then their effective outcome, do they really get it? Because in healthcare, we're moving towards the patient being part of the healthcare team, and we're also helping them to be independent. We have so much chronicity, we can't keep chronic patients in the facilities, right? We have to have them be independent, we have to have them on home care, they have to go to clinic visits. Those things, we're making them more independent. So this effective outcome, thinking about patients as they become independent, moves us to this morphing the responsibility. So we used to say, oh, you're not compliant, you're not complying with the plan of care. But we can't make them do anything. We can't make them comply. They have to adhere. They have to understand that, you know what? If there's a mistake when you go out those doors, it's on you. It's not, the healthcare provider cannot carry the burden of what the person does out those doors. But we have the obligation to teach the patients and give them the tools to succeed.